Good afternoon, everybody. I realize this is just about enough time for the food to kind of hit the bottom of the stomach, and everybody's feeling a little tired. And so I'm going to change the pace and, well, start with a few words of introduction. I am kind of the outsider, just looking and listening to the people around me here, and I guess I'll know if this presentation was a success if I get invited again or not. May want to keep me as an outsider. My background is in engineering in the commercial space. So I worked for what is now a large telecom company, Qualcomm, and was lucky enough to participate in literally this wave of creation of mobile devices. I was in on the very early days when we invented the cell phone. It's not quite true, but been doing this for 25 years. It's been a fantastic ride. Now, when I used to go to various meetings in the commercial space, people would always ask, you know, how many of you guys use an iPhone? Or some people would raise their hands. And how many people use Android or Windows or whatever? And there was always some portion of the population. And when I got lucky enough to be exposed to the healthcare side of things and looking at the integration of technology and healthcare, it was very easy. You'd go to a conference and says, okay, how many of you know somebody who has been sick? Well, and the answer is everybody. And so it was very easy for me to realize that there's a calling here on how to embrace technology and into the world of healthcare. Now, coming from the commercial space, I very quickly realized that we were talking very different languages and sometimes different time constants and different motivations, and it's been a wonderful learning experience. But ever since I've been on my own, I consider myself belonging to a think tank of one person, which is me, and it's amazing how rarely I can achieve any kind of agreement. So it's quite bizarre. So what when preparing for this presentation, I was trying to think about what I would like to say, and I decided that the easiest way for me to think about things is to share with you some observations, which hopefully are relevant, and especially given the presentations I've seen throughout the day. There's some overlap, but some amazing stuff I've heard and learned today, so I feel privileged. So observations. I'm going to share a couple of examples, because when you're in the world of technologies, examples come and go very, very quickly. And I have some observations about why that may be true or not. And then the third is I wouldn't call it recommendations, but maybe things that we can consider as we go forward. Last comment I'll make is the quality of my slides. Some of the slides I've seen here were beyond amazing. I started out making these notes, and these were kind of my own notes, and I was more, as Wendy said, you were bullied into handing them over. So what you see is things that are going to help me frame this talk. And so, again, coming from the commercial world, we tend to think about things in terms of infrastructures, or you heard a lot in terms of platforms, but there are really a lot of utilities that we've grown accustomed to, and again, depending on what part of the world we're looking at, you have more or less access of. And I think one of the earlier speakers mentioned access to cell phone versus access to running water or brushing teeth. And it's true that communication using cellular technology now is the most prevalent utility in the world. And even places you think when there's no running electricity, people still make do with cell phones. They have solar chargers. They find ways to share cell phones. But it's absolutely amazing. And that's a tool that we've heard discussed throughout the day. But there are other infrastructures, especially when it comes to healthcare, which are, again, the theme of education, teachers, people who, and then there are the healthcare professionals. And when, again, where I come from, we tend to think about scalability, you very quickly realize in any technological solution that if you have a 1-to-1 ratio, if for every time you want to scale your platform or your infrastructure to go from n people to n+1, if you need to add another person or some large fraction of a person to support that, it's not going to scale. And if you look at seeing some technology aside, okay, there we go. And so when we hear about mHealth solutions or packages and whatnot, typically, and again, there are always examples that are different, but in general, the conversation evolves around sensors. How do you collect the data and the sensors have many shapes and forms. They usually involve a smartphone of some shape. They assume, for the most part, that you have a continuous internet access, because we heard about secure email, we heard about secure video conferencing. Again, when I have a video conference, somebody has to be on the other side to take it. That only scales so much, and I'm sure you can comment on that as well. And then today, especially because of the tools we have, but also somewhat because of regulation, at least one person either helping people set up the equipment in the home or answer the conversation has to be a very, what I consider, high level of expertise. And this conversation I had quite a few years back when we were trying to help folks in I think it was in the Philippines, address a problem they had. Same conversation I had with people from India as well, where they said, look, we have large populations that have no or almost no healthcare whatsoever. Can you help us to take the most educated person in the community? We think maybe they took a few years in high school, we're not sure, but that's our highly educated individual. We want to give them a set of tools so they can go around the community and maybe ride their bike to the next community next door and collect things like names of people who live there, maybe measure their height and weight. We're not talking about anything very sophisticated, just basic metrics. And very quickly, the instinct says, oh, sure, we can build a device, connects to that, and automatically register it up in the cloud and do all these wonderful things. And very quickly say, well, wait. They don't really have power there. So whatever you give us has to last for 12 hours, maybe, until they get back to where they can charge it, or maybe if they are lucky and have a car, maybe you can charge it from that. And the coverage, well, that doesn't quite work very well. If they're lucky, they have intermittent connectivity there. And so when you look at it from the engineering innovation point of view, you ask yourself, okay, these are assumptions. Are they valid? Will they help us scale? Will they make things cheaper, make them more accessible? Why are these assumptions even there? And so obviously, as I mentioned earlier, we need a way to improve the scalability. If we're trying to reach very large populations, or we're trying to even reduce the cost of healthcare, we need to have more people or less people serve larger populations. Those are, it's simple math. And so I'll touch on some methods that can help do that, but it's obviously not going to be by adding more healthcare professionals. We have to make things more accessible. We have to make them usable at a level that requires less education. We heard today about how do people, how to get people engaged with the technology. How do they learn to use it? And again, there are different ways to do that. So literacy can be improved, but also things can be simplified. My typical example is that my father, quite a few years ago, he had a PDA for many years and he lost it. And he was heartbroken. He was like, I had everything on it, I don't know what to do. And I said, have you thought about buying an iPad? And he goes, well, no, I'm so used to this Windows stuff. I said, try it. So he buys an iPad and he calls me up. He says, you won't believe this. I said, what? He says, it did not come with a manual. I said, so what did you do? He goes, well, I turned it on and it just worked. And so, it's sometimes we're trained to look at things a certain way because that's the way they were done. And when somebody creative enough can change the paradigm and say, look, we can actually build things that are simple, that require less literacy. And it's a challenge. It takes very few people have successfully done such major shifts, but it can be done. Costs is another interesting thing. We know that the device costs keep going down, but especially in the US, the connectivity costs have not. The United States is not a low-cost wireless or internet provider. It is also not the world's leader in speed or coverage. Many countries have lower cost, better cellular connections and internet connections than we, the US, do. Some of it is indirectly through regulatory forces, right? We have only so many carriers, competitive, blah, blah, blah. How you sell spectrum. But the fact is that we've created an environment that in theory we should be able to change that could reduce the cost of connectivity. Works all the time. Again, that tends to be a requirement that comes as a result of some of our regulatory needs. If we insist that no user-specific information, and we heard that about different, I took a picture of my pills, of my whatever, and I sent it off to the doctor. Okay, there are quite a lot of restrictive regulations about what you can store on your phone and how you store it, which increases complexity, increases cost potentially, and in some cases, the easiest thing to do is say, look, I'm not going to even allow you to use this app unless you have some connectivity, in which case nothing is stored on your phone. It all happens to be up on the server, which simplifies life, but on the other hand, makes other technical requirements. So some thoughts, okay? So smartphone costs are going down. Moore's law is, if you guys are familiar with it, basically says that it's the density or the cost of silicon halves, or density doubles every 18 months. It's after Gordon Moore, who is the founder of Intel. But although with DNA sequencing, it's even much faster. The slope is much higher. And so the cost of phones is dropping both from the components point of view and through various subsidies and whatnot. So the assumption that people used to make that, I can't afford, or users won't have a smartphone, I need to build a solution that's targeted towards old flip phone and only use SMS because it's the lowest common denominator. It has some relevance, but as we heard earlier today, it's no longer as true. The elder population is moving towards smartphones and tablets, and so are the younger populations, and as in between, we have to fund both of them, so I as well buy one for ourselves too, right? Continuous internet access, again, that's something that we can improve as a country. There are actually places in the US where you don't have good coverage, and those are usually underserved communities. Why? It's a business decision. Can there be policy, regulatory things that help accelerate that? I think there have been attempts. I haven't seen them as successful. Patient to provider ratio. So I said, okay, you get a plus on the technology and you get a minus on the regulatory. And all I'm trying to say here is that, and I'll give an example to right after this one, technology that allows to scale the ratio of the number of patients to a provider exists. And the way you do that is well, there are different ways to do that, but if you think about what the banks have done for us, okay? It used to be that whenever you want a transaction, you'd go to the bank and there'd be a teller, one-to-one. You'd stand in line and you'd tell them, okay, I would like to, deposit a check. You do that, and you'd like to ask, what's the balance on my account? I remember I had to do that for my grandmother. I'd go and stand in line for her and make sure that she could talk to the teller because that's the only way she trusted the information. Well, nowadays, do you even know where your bank is, right? You get all the information online. You deposit checks electronically, take a picture of them, and most of the time it works. Use ATM, distributed dispenser for cash, and on rare occasions you actually have to go to the bank. we have to create similar analogies for healthcare system. We need to be able to deposit our health data electronically, okay? We need to be able to interact with our health record or health information or health systems when and where and how it's convenient to us. And to do that, we need to be able to automate more of these processes, including the ability to get, take a picture and get some information back from that. And I'll give an example quickly. Same thing for medical expertise. There's been a lot of talk on how do I, as we start collecting all this information about not just health records, but actual biometric signs or photos or videos, ultrasound. It's a very hard technical problem to create automatic systems that, I hate to say make medical recommendations, but assist the physician in more quickly eliminating wrong answers. Let's put it this way. Those are very, very challenging and complex problems, but they're also, and I struggle with the words because there's a lot of regulatory hurdles that say, look, you can't make a medical recommendation as a machine. That's now a medical device. Now you have to go through this incredible hurdle of becoming approved, and God forbid you change the software. Now it's a new device. Well, what have you used in the software world that hasn't changed? If you download the latest operating system on your phone, the next day you get 48 apps that all changed. Well, guess what? Do you need to go through another regulatory approval for that? Can't do that. So a couple of examples that I'd like to share with you. So the first one is cost of development for what's called web services or things that are on the web. So this is an example that I borrowed from my friends at Amazon Web Services. And Amazon sells books, of course, and they sell groceries, and they sell music, and they sell anything you want. But one of the things they also do is they are an infrastructure provider for computing and storage. And they started this because they needed it for their own uses, but they have aggressively made this a total commodity to the point where it takes you literally a credit card and 5 minutes to basically have a web server running up on the cloud, on the Amazon cloud. It's amazingly easy, but they've gone way beyond that. They are actually courting, they're aggressively, or not aggressive, well, Amazon's aggressive, so they're aggressively courting people who are trying to build solutions in the health and life sciences space because they believe they want to be the provider for those services, and they believe that the more they understand the needs, the better tools they can build to enable more of those solutions. And one example they gave just last week is one of the large drug research companies wanted to do some very large, complex analysis of a drug they were prototyping. And it involved tremendous amount of simulation hours. And so their IT group came together and said, we need to buy these racks of servers, and we're going to have to build a room and air condition, and it's going to take about 5 years and several millions of dollars to get it all, set it all up, configure it, run it so that we can actually do this very, very, very complex simulation, or set of simulations. And so the researcher says, well, can we try to do this on Amazon? And they said, sure. And now Amazon, they call it an elastic cloud. They have, I don't know, hundreds of thousands of computers. I have probably millions. I don't even know the number. And literally, you just say, I want to run this. And just charge me as much as you need for you to run it on as many machines as, and you just say upper limit. I want 1 computer. I want 1,000. I want 10,000. I want, and literally it just runs. And so they were able to complete this simulation in 6 months, and it only cost them $5,000. And they never were left with old IT equipment that somebody has to manage or throw away and get rid of. And there's just, so when you start thinking about possibilities, I was looking for a different project on what it would cost to be able to process something like about 1 million transactions per minute. I figured, okay, I'm going to have the connected devices with from patches, wearables, and thousands of people. Very quickly, you start getting millions of transactions per minute. And you go and you can price it there. They say, oh, you want this bandwidth, and you want this, and you look at it as, yeah, it's going to be about 45 cents a minute. 45. It's like, pennies. It's absolutely ridiculous. So the world is changing. The way we think about the world is changing. And so one example, I hope you guys are familiar with this, is the XPrize organization. And I've been privileged to work with these folks both on this competition called the Qualcomm Tricorder XPrize, but also on what they call the Nokia Sensing XPrize Challenge. And the idea of the XPrize, for those who don't know, is the idea is very different. They said, look, if we are able to define, 2 minutes, okay, I better hurry. I knew I'd run to this. I can talk forever. Okay, I'll be very quick. So the idea was, look, if we can create a big enough challenge, prize, that involves money, publicity, and we can get people to spend much more money to try to win the prize than actually purse of the prize. And not only that, we're going to change the rules and the behavior and how people go about doing things. And so the Tricorder XPrize is a health-related prize, and the idea is that there are now 10 finalist teams, and they all have to be competing to prove that they can diagnose with a set of things, you don't tell them what, that has to weigh less than 5 pounds, you can carry with you, right? And you can diagnose 16 conditions and measure vital signs continuously for up to 3 days, 72 hours. And by the way, it has to be operated by a patient, not a trained physician, and give them advice. Oh, and to win this competition, obviously, you have to do this right. You can't diagnose the wrong things. But 25% of your score is based on how the users think, how good a job the user thinks you did. Absolutely, we talk about user design. You won't win if you have something that looks like a normal medical device, because the patient goes, I don't understand how to operate this thing. So part of it is how do you improve the usability, literacy, and I can go on and on. CaptureProof is another interesting example where they said, look, we want to be able to take texting and move it into the image domain. It's a multimedia. So if I'm a patient, why can't I take a photo, send it to my physician? The physician has tools to look at how my injury progressed over time, or how my walking evolved. It's a video and whatnot. And it's a fascinating tool because it also allows asynchronous operation. The patient does his thing when they want to. The physician or nurse or whoever needs to look at it looks at it at their own leisure. It's not a video conferencing service. So now a physician can be much more effective and say, okay, I'm going to spend an hour and look at all these pending things. They can forward it to other physicians for consultation. So we're looking at how you can scale by not requiring a physician to be online to interact with you. You use off-the-shelf tools to do this, but the interesting thing is they need to be online in order for this to work because of the HIPAA regulation, that the way they interpreted it. And unfortunately, it's a small startup, so they're running out of money. So now you get into, well, okay, I'll skip this one, and I will skip this one, and I have many, many more things to talk about, as you can see. So I'll just talk about, I'll talk about the funding because, yeah, and then I'll quit. So we heard a lot about the fact that device life cycles are much shorter than research application to publication type life cycles. And so somehow we have to be able to tailor those to use what the subjects already have. It's using the tools, using the apps. If you have to write new ones, by the time you're done, they're off to something else already. That's the attention span that we're trained to use these days. Work with startups if you can. It's a challenge because they have other motivations, but on the other hand, they get a lot of benefits by being associated with reputable institutions or researchers, because they can then go to their VC and says, look, we're part of something that's proven to be effective. And I think I'll just stop here because I've run out of time. So come ask me any questions you want.